welcome to Fitness Casual. We help you ditch diets and build habits no matter how busy you are. I'm Andrew Hayes, and with me is the not often medicated Kat Best.
Hello.
Maybe sometimes. Kat, have you ever had a crazy experience with maybe an over-the-counter medication or a common medication?
Yes, I totally have. And this was, not my most proudest thing to admit, but this was back in the day, maybe like early 20s Kat. I definitely had a phase of using pseudoephedrine products. They were, they were kind of like a fat burner, like a natural fat burner. So I definitely had a phase of using that, not because I had sinus congestion, but because I thought it did blunt appetite, definitely gets the heart racing and does all of the things that like a fat burning product would do. But I wouldn't say I paid for it, but I do think it like backfired in ways as far as like nutrient absorption and just like not good for my overall health, but clearly not good for my relationship with myself. But there's a lot of sneaky tricks like that with over-the-counter products that if you're in the wrong circle of people, like a bodybuilding community, they use that for not the right things, or caffeine pills even, like little things like that. So yeah, I dabbled, but right now I really try to actively avoid using those as much as I possibly can. Like maybe a Dayquil if I'm really congested, but I really try not to.
It is just crazy how readily available all of these things are, which is obviously why we're doing this episode today. But pseudoephedrine is such an interesting one because it is harder to get now. It is usually locked or behind the counter, but that's because it's used to make meth, which is not great. But obviously it has nothing to do with the story that you just shared, which is very common. And there's hundreds and hundreds of medications that are available all the time. I have had restless leg my whole life, although it's basically gone thanks to my focus on nutrition. Thank you to my coach, Kat. And for a while, I struggled with getting quality sleep because of it. It wakes you up a lot at night. And so I was taking different antihistamines. Benadryl is usually the most common. A lot of people take that as a sleep aid. And antihistamines are actually a massive trigger for restless leg, which I did not know. So I was having trouble sleeping with restless leg, and then I would take a Benadryl to sleep better, and it was making it worse. And this is, again, one of those things, like if you Google that right now, it's very common knowledge. It's been studied. It's out there. I just didn't know. And it's crazy how many side effects are studied and proven, but just aren't tribal wisdom for whatever reason with all these drugs. So today we're only going to tackle a few. This is a very complex topic. I would say it's over-the-counter / common prescription medications. There's 3 categories we're going to cover today. We are not physicians, Dr. Kat. We are not physicians. We are not pharmacists. We are not nurses. But again, we are just bringing to light side effects that are very well known, that are very well documented. We don't have tinfoil hats on. I think, Kat, we do a really good job in our program and in general of finding the balance of natural lifestyle and Western medication. And like there is very much a place for you and your physician and pharmaceuticals. But there are also times where I think we reach for a medication without knowing how bad it can be, and or without knowing that there are better ways maybe to treat that, at least first, before grabbing the medication. And I will share my acid reflux story today, which is a great example of I would have been on a pill for the rest of my life had I not figured that out. And so we want to just bring to light some of the very common medications, OTC or prescription, that people reach for when there could be a better way, maybe at least to start.
And I want to say when I was in my holistic nutrition program, this was something I really loved, is that they actually talked a lot about this, but how addressing the root cause is the most important thing. So everything we're going to get into, as far as what the negative side effects are or natural alternatives, the whole idea is to address the root cause of the dysfunction. And if you fix that, then the problem will go away and then you don't need to take something. Whereas a lot of these over-the-counter medications don't address the root cause. They're a Band-Aid approach. They don't actually fix what's going on. So therefore, when you're just not taking this medication, it doesn't actually resolve what you have going on. So that's going to be a common pattern that we're talking about. And the good thing is a lot of the underlying reasons that you might have acid reflux or back pain or whatever, like there are so many natural alternatives to those things when you understand like what's actually going on with acid production or inflammation, and that's kind of what we're going to get into today. And we're not trying to make you feel bad. I know some people take like a lot of Advil or have been on Prilosec for 20 something years. I'm not trying to make you feel bad, but we're just trying to give you something to think about that maybe you haven't before, and then relate it back to your overall health. So that's all we're trying to do, is just bring awareness to a topic, but we're not trying to convince you not to take the things. But once you have a little bit of knowledge, then do with that what you want. But
That's right.
These are things a lot of people don't know, like shockingly don't know. So that's why we think it's really important to bring attention to.
That's right. And it's always, especially if you're on a medication with your doctor, it's a conversation with your doctor to come off of medication. Even in our formal program, we would never take you off of a drug. But we thankfully have coached so many people, Kat, you more than me, but even hundreds in our program together. And we've seen countless times of this working, which builds the confidence. So we can share some anecdotes today as well of various things we've seen with our clients. So if you are on a medication and maybe you want to come off of it and you're not sure it's going to work, hopefully this not only brings awareness, but maybe also some belief that it can help for you too, because we've seen it time and time again.
Yeah, absolutely. All right, so we're going to start with NSAIDs, because this is probably one of the most popular ones. You see, everybody has taken Advil, I'm sure, at some point in their life. NSAID stands for non-steroidal anti-inflammatory drug, and they're one of the most commonly used pain relievers in the world today. I think I read this stat. It said it's estimated that every single day in this country, more than 30 million Americans take NSAIDs for common pain issues like a headache. So like these are like really low stake things you have going on, and people pop Advils like it's nothing. I used to take Advil a lot when I was younger because it was like in our pantry, and I was like thought it was like something adults did, so I took it for like no reason at all. But I remember like headache, pop it, you know, a little back pain here, there, pop it. Like that's what most people do and what we're conditioned to do. So if you do that, like just, it's okay. A lot of people do it too, but we're just trying to inform. So common brand names of like over-the-counter NSAIDs would be anything ibuprofen or Advil, Aleve, Motrin. Tylenol is not an NSAID, and this is like, I still, took me a little bit to understand this. Acetaminophen is not an NSAID, and it does not reduce inflammation. It can like lower fevers or whatever, but it actually doesn't reduce inflammation. So that's just one good thing to keep in mind. We're not talking about Tylenol today, but I do think like throwing that in there is important. So how do NSAIDs work? They basically work because they block the body's production of chemicals known as prostaglandins that cause inflammation and pain. So they just don't really allow your body to inflame. And one thing we know about inflammation is the body needs to inflame to anti-inflame. So that's one issue these cause, is they sometimes don't allow the beneficial process of inflammation, which allows your body to work something out or like get rid of a pathogen or do something that there's a reason the inflammation's happening. These NSAIDs just block that, and that also can block healing or all sorts of other things, but that's really the mechanism of how they work. One thing that's pretty crazy is that the dosage of over-the-counter NSAIDs can be exactly the same as a prescription. And a lot of people take a larger dosage than they need. And also a reason for that is you sometimes need more and more over time to get the job done, or you know, get the effects you're looking for. So a lot of people take like a really large amount of these, but don't realize that there are some negative side effects. So some dangerous side effects that are also very clear in the research, like this is not my opinion. I really did like a good amount of research to make sure I'm not sharing like things that aren't rooted in like clear research here. But some main things we see are stomach bleeding and an increased risk for heart attack and stroke, but especially like damage to the GI tract, which could be your esophagus, stomach, and intestines. And here's a stat from a gastroenterologist, was that more than half of all bleeding ulcers are caused by NSAIDs. Wow. And that's especially more at risk if you smoke or you have other medical issues. So just know, like if you're fixing your pain with a bunch of NSAIDs, but you're causing like gastrointestinal ulcers, and you know, you're having all of these other things, like that's not worth it. And there's the reason that's happening, you know, and it can be pretty profound. And then, you know, a 20% increased risk of heart attack or stroke is wild.
Yep.
Just to take something, so for, you know, so you don't have a headache in the morning, which if we look at headaches, like there's 5,000 reasons you could be having headaches. And if you just address the root cause, then you wouldn't need to take the Advil.
Yep.
But unfortunately, not many people are telling you that or sharing that information with you. Side story, we have one client who came to us and she had headaches every single day, like really major headaches. And she drank a ton of water because she thought the water would help the headaches. But turns out the water was actually was depleting her electrolyte balance. She had no sodium in her diet. That's why she was having all these headaches. So on top of drinking a bunch of water, taking Advil all the time, we just lowered her water intake but increased an electrolyte, and now she doesn't have any headaches. And that's years and years of her dealing with that. And also she's like a very high performance individual. So just imagine how profound someone who just knows why you're having that headache, like that could be. And I think that goes for any reason that you could be taking the NSAIDs for.
And again, it's not, you know, your fault. This is every single drugstore in America, every bodega, every Target has these available. Advil ran a Super Bowl commercial 2 years ago, which I had a lot of beef with because it was like showing people dancing and they're like Advil. And it's just like, it's very common to think this is the right solution. And so we're sharing these stories and sharing this to encourage you that, yes, if you are taking it daily or weekly or whatever, it might be a little hard to come off, right? Like It might take a week or more. And we have some more stories to share there about the transition, but we want to build your confidence that like you can do this and it will be much better on the other side and reducing the risk of ulcers and all of that, in addition to just solving the root problem. And so take this as us encouraging you to explore a new direction, not shaming you, as Kat has already mentioned.
Mm-hmm. Yeah, and so one thing when we think about like inflammation, you know, getting to the root of why you are inflamed, you know, your body is trying to fix something with that inflammation, so we want to listen to that. But the good thing is there are a ton of natural alternatives that help lower inflammation, because ultimately, like, that's what these NSAIDs are for, is to reduce inflammation, so we want to do that naturally. And there are so many ways. Before Advil was invented, a lot of people were managing their pain with all sorts of natural things. And like, this is not, I wouldn't even say this is in the category of like woo-woo or anything. Like, this is very proven that these things work. So just want to share like a few things you could do instead. Turmeric is one of the best ones. It's been used for thousands of years. Turmeric has been around for forever, and it's definitely effective when it comes to relieving pain, either localized or just overall in your body if you wanted to reduce inflammation. About 400 to 600 milligrams, taken about 3 times a day with black pepper. So one thing is, for whatever reason, black pepper helps the absorption of turmeric. So most supplements will have black pepper in there, but if you're using like the actual turmeric powder on like your food or something, you just want to make sure there's some pepper there. And that can really help. A lot of people like taking turmeric on a regular basis to help control inflammation, like a lot of athletes or, you know, people who do work out a lot. I think this is a really common one that is pretty effective. And then another one is fish oil as a supplement, or just eating enough omega-3s in your diet. One thing that really resonated with me when I was in the holistic nutrition program was how important fats are for pain and inflammation. Fats they also help your body release the natural prostaglandins that help anti-inflame. So the more fats you eat, that could, good quality fats, that could also help your body just manage inflammation better. Fish oil is huge, especially for people who have joint pain, like osteoarthritis, rheumatoid arthritis, bursitis, like any of those like really like chronic painful conditions that aren't because you like squatted wrong. It's just like it's really long term, and that's where like you're taking Advil every single day for years and years when you have these conditions. So taking a fish oil or consuming enough omega-3s could be really profound. And enough omega-3s looks like 2 servings of fatty fish per week. Fatty fish would be salmon, mackerel, herring, tuna, sardines. There aren't that many to choose from, and this is why a lot of people are deficient in omega-3s. I try to eat salmon at least once a week. Twice would be great, but I don't usually get there. But I do think like a fish oil supplement is pretty approachable for people. But there's a lot of fish oil supplements that go rancid or they're like pure trash. they're not like it's really tricky, but one brand that is pretty good is Nordic Naturals. So that's like a really good one to look for. But overall, I think eating it is always better. And then natural sources of omega-3s could come from walnuts, or sorry, plant-based sources would be like walnuts, nuts and seeds, avocado. So those are good things to have. But I do find that the more healthy fats you have in your diet, especially coming from plant-based sources, the less inflammation and less pain you will probably have. And a lot of people don't eat enough fats, especially from like low fat dogma from like the 80s, 90s. People are really afraid of fat, or like won't even eat an avocado because they think it's going to make them fat. But like those are the foods that really help your body manage inflammation and pain and could make like all the difference in the world.
And inflammation is a large rabbit hole. Maybe we do a podcast episode on it, but just like in generic terms for this episode, there's a few different ways to look at it. One is your internal inflammation, which when you're eating ultra processed foods, things like that, which is a lot of what you're talking about, Kat, with balancing omega-3 and omega-6. There's also inflammation when you go to the gym and you're building muscle. Like that is inflammation is just your body's response to stimulus. And so in many ways, it's good. As you've mentioned, I think it's become kind of a negative buzzword on social media, like with cortisol, and everyone's like, every time you hear it, it's negative, and it's actually not. It's very natural. And so when it comes to something like twisting your ankle, this is where it gets a little tricky, because you want your body to heal. You want it to swell. And there's actually a lot of research against the icing your ankle because you want the inflammation. But then if you talk to a doctor or a PT, they say, but they want you to move. So you should take Advil because it will increase your ability to move. So it's a little complicated. But I'll share a story where I had a procedure a couple months ago, and the doctor prescribed me, Advil basically, that I could have gotten at the store, but he gave me like the 2,000 milligram version. And I was like, listen, do I have to take this? Because I'd rather just like be in a little bit of pain and let my body heal faster. And his response, and this is again uniquely for the situation I was in, he was like, what you're having is not a natural procedure. Like you're having an invasive surgery. So like you don't want that inflammation. Like you want your body to heal quickly. You want to reduce that inflammation, which is different than being sore from the gym or throwing out your lower back, which is your body's way of saying, don't go back to the gym because your back hurts. So it's a delicate dance for sure. And so again, talk to your physician as needed, but just want to make sure people understand that like there's lots of ways that inflammation exists.
Yeah, absolutely. I think you touched on a really good point about the ice. I think that used to be like what everyone did when they were injured, like on the sidelines, you sprain your ankle, ice goes on right away, and that just helps pain. So for pain management, ice can be very effective, but like for me personally, I really try to avoid ice because you're just slowing down the healing process, actually. There is an approach, it's called no pills, no pain. So it's just kind of like, don't take anything for pain, but don't do things that hurt. And that's how you'll heal fastest. So, if you hurt your ankle, you could still go to the gym, do your upper body. Just don't do things that hurt your ankle, but like also don't take something for it, and it will probably heal much faster. So I think that's a good approach, but obviously there's a lot of nuance there. Pain tolerance is another one. But for like the little things like the headaches of the world, or my posture sucks, so my upper back hurts, like that's not a good reason to take Advil. And that's what we want to, kind of maybe enlighten people on, that there are just other options. But always getting back to the root cause. The root cause will always find you a better answer. And that's really what a holistic approach is just kind of understanding your body as a whole and like, why is this happening to begin with? And then one last thing for natural alternative would be green tea. I think this is like a really fun one because like green tea is pretty easy for people to drink, but green tea is so rich in polyphenols, flavonoids that reduce inflammation, especially when it comes to arthritis or like irritable bowel type of stuff that pain people could be having, or rheumatoid arthritis. Like green tea every day, like a cup, is pretty good. And that's also has a lot of other health benefits if you don't have pain, but that definitely could be something. A cup of tea per day, pretty easy to do, and if that helps inflammation, like why not? Or if you combine a few of these, like start taking a fish oil supplement, have green tea, and then add turmeric to your dinner, like you can do all three in one day, and none of that is all that hard to execute. Okay, so that's NSAIDs. So next we're going to get to the PPIs. So, and that stands for proton pump inhibitor. So the over-the-counter products you all might be familiar with would be like Prilosec, Nexium, Prevacid, and of course there are a lot of prescription ones, but I think they kind of operate exactly the same as these, but we're more referring to the over-the-counter ones. So what these do, they reduce the amount of stomach acid your body makes, which is okay for short-term use, but these have major side effects for long-term use or when you try to stop using them too quickly. And that's like a big area. I think these are widely used for years and years and years at a time because of the rebound effect. We're going to get into the rebound effect in a second, but first I want to talk about stomach acid. So stomach acid is really, really important. And your stomach acid is needed to break down food properly. And your stomach acid needs to be at a specific pH in your body in order to break down food. If it's not, let's say it's too alkaline or you don't have enough stomach acid, that will impact the way your body breaks down food and can cause all sorts of digestive issues. And this is the main area where PPIs really cause havoc in the body because they reduce the amount of stomach acid. So people think they have too much stomach acid and that's why they're getting acid reflux. That's not why. It's just firing at the wrong time, like coming up at the very base of your esophagus, there's called the lower esophageal sphincter. If that flap is opening and closing at the wrong times, which are likely due to lifestyle stuff, then the acid comes up and it feels terrible. But that's not because you have too much acid. It's just because it's not supposed to go back up. So the PPIs can lower the acidity, so it's not stopping the acid from coming up. You're just not feeling the burn. But it's reducing that stomach acid, which then means, your body is not breaking down food properly. So this leads to gut dysbiosis is a big one, SIBO, big one, or leaky gut, all sorts of intestinal things. And it just puts you at a much higher risk also for nutrient absorption issues. You're not absorbing nutrients the same when your stomach acid is impacted. And this is why fractures, osteoporosis, these are side effects of long-term PPI use because your body's just not absorbing nutrients anymore. This could cause anemia. This could cause all sorts of issues. And stomach acid also is a barrier for pathogens. So if you have reduced stomach acidity, then you are more susceptible to specific infections. C. diff is one. That's a big one. When people get C. diff, it's a big issue. You're in the hospital, you're on antibiotics. That really creates a cascade of really difficult things, but the most common one is probably SIBO. But either way, those are things that once they happen to your body, it's very hard to undo. You have to be very regimented with your diet and lifestyle things to undo those things. It's not just a simple, eat more protein, drink water fix. It's really hard when your gut bacteria is really, really damaged. And, that's, for me, that would be the main reason not to take one is just the digestive side effects are pretty profound. But there are other side effects like headaches, migraines, fatigue, muscle spasm, and cramps. And a lot of that just has to do with your body not getting enough nutrients, but that diminished stomach acid really causes all sorts of issues. I'll share one story from me. So after I learned all about stomach acid and why it's so important, the program I did literally talks about stomach acid like it is the most important thing. So I, at the time, had serious gut issues. I was bloated all the time. I was constipated. This was also, I was a personal trainer, and I was really embarrassed by the fact that I had all these issues and I just didn't know what was going on. So I started, once I learned about the magical stomach acid, I was kind of I don't think my body produces enough, which is very common for people who have gut issues. So I started supplementing with HCl, hydrochloric acids. I'm not telling you to do it, but it's a very common thing people would do with each meal. And then my digestive issues got so much better. I wasn't bloated after meals, so I was actually getting my stomach acid back up to par because I didn't have enough of it. And this is just such a common misunderstanding of people have about stomach acid. So I just want to reinforce you need stomach acid and you need a good amount of it to break down food properly. And anytime that's not happening, it could be just because there's insufficient acid.
Having it come back up, by the way, which is acid reflux, GRD, which I had, just to add to the side effects. So if you are masking you physically feeling acid reflux, but you still have it, as you outlined, your long-term side effects are increased risk of esophageal cancer, chronic cough, dental erosion, throat irritate. This is, again, taking the medication will help you in the short term. Talk to your doctor, sure, maybe, but don't forget that stuff is still happening that is bad for you. And you want to address that root cause, not just to get off the medication and save you money, but also to prevent what could happen to you long term. And this is like what scared can we curse in this podcast? I should know the answer to that.
Yeah, fuck yeah.
This is what scared the shit out of me. When I had my acid reflux last year, I was like, one Google search and I was like, all right, I got to fix this. But, lots and lots of millions of Americans taking Nexium every day for their whole life. It's like the dangers are real. And so not trying to scare everybody, just trying to make sure people know that just because someone tells you to go buy this thing and take it doesn't mean that you're all good now. And it might mean the opposite.
Yeah. And if we're getting to the root cause of why you have low stomach acid, that's where lifestyle habits come in, or like drinking a lot of alcohol or just eating poor quality foods. Like, you need to eat whole foods to also have healthy stomach acid production. So that's like a really important point to make. But I love this one study. So this kind of proves the point of the rebound acid, which was that a bunch of healthy volunteers who did not have acid reflux or any stomach issues took PPIs for 8 weeks and then came off of them, and then they had a lot of acid reflux and stomach issues. So they proved that people who had no issue took these, and then all of a sudden they had like raging acid reflux. And then like, what do you do then? Like, that just goes to show like you could create a problem by taking these. And I think people will also take this if they like ate a little too much like Taco Bell or something. Like, they're taking these for not because you really need, it's just like you're trying to prevent temporary discomfort. But if you do that over and over, and then you're like, wow, my acid reflux is getting way worse, take more. Like, that's what's happening. And this rebound acid hypersecretion, that's what it's called, is something that is very well known. I think a lot of doctors are aware of this, and I think they are changing the use of PPIs, but it's something that people who have already been taking it for a really long time, like, you have to wean off. And it's really hard, and you're going to have some really uncomfortable moments, and that sucks. But, the impacts of having bacterial infections in your gut and like a cancer risk, like, those are so crazy just from something to, have that temporary relief, that Band-Aid of just having that reflux.
And I am fortunate. I've shared this story on Instagram, and I'll share it here too. I had an issue with acid reflux last year, and so Kat, you helped coach me on that. I was fortunate in that it was recent. I was like, hey, this developed in the last 6 weeks. And generally speaking, when something is recent, it's easier to treat it quickly, as opposed to if you've been dealing with this for 20 years, it probably won't fix overnight, but you still can. But for me, it really was just a couple weeks of sticking with it, of not reaching for the PPIs, which I definitely was tempted to, especially like when you're woken up at 1 a.m. That is not fun. And for me, it was a lot of things, a lot of small things, but vegetables with all the meals to help with the acidity, chewing my food more slowly to help with the digestion, reducing carbonated beverages, which are acidic. Like, it was small things, and I was totally fine to eat a burger and French fries and all that stuff 2 weeks later. Like, it's not like you have to say goodbye to everything, but it can be hard to do this alone when it feels pointless. It feels like, what is chewing my food more slowly going to do when I could take Nexium? I totally understand that mentality. So hopefully, again, like, you trust us with this. We've done this with many clients, and even done this on myself. And you can go watch the video on my Instagram of how this worked. And of course, stress. This happened while I was moving last year, which I talked about in the video too. And that's something that I see all the time with clients. When I talk to people prospective for our program, they're like, well, I'm feeling all these symptoms and XYZ, but also like, now is not a great time. And I totally understand that mentality, but my response is always like, that's exactly why we need to do this now. Like, I understand you're moving, or I understand that like your kid is sick or whatever, but like, that's why you're having challenges, and that's why now is the time to focus on it. And I know that makes it even harder, but it's all connected, right?
Yeah, absolutely. As far as what to do, natural alternatives. So one, going back to the lower esophageal sphincter, we want to make that not do crazy things. So a lot of lifestyle habits also can help that. So trigger foods, caffeine, alcohol, spicy foods, and citrus actually can cause dysfunction of that area in your throat. So sometimes it's not even about like the acid, it's that muscle is acting up at the wrong time, and those are like the biggest triggers for that. So even just drinking a little bit less, maybe a little bit less coffee or carbonated beverages, that could make a big difference. And remember, it's only temporary until you start feeling better, and then you bring it in little by little. But that would be one. And then also have smaller, more frequent meals to reduce stomach pressure. pressure. If you eat really giant meals, that is more likely to come back up because the stomach acid isn't there to break down the food, right? So it starts going up the wrong direction, and then you feel terrible. So if you're eating small meals, that allows your stomach acid to like have a little bit more time to digest, and it's just not causing like a big backup happening, and you'll probably feel a lot more comfortable. So maybe that could even be like 5, 6 small meals throughout the day. That's a lot of times that you have to feed yourself, but again, only temporary, and then you could get back to bigger meals. But if you notice you have a giant meal and then you go to bed, and yeah, you're gonna have acid reflux. That's like a recipe for that. So just trying to change up your meal size and frequency could be a really good one. And then there are a lot of things that increase stomach acid production, which I know sounds counterintuitive, but that kind of like circles back to why you have these issues. And that would be ginger. Ginger is phenomenal for soothing any digestive issue you may have. I'm a big fan of ginger tea. I try to drink at least like a cup every other day, maybe. Like, I love it. I think it's really soothing. So that could be a really good one. Or put ginger in your food, like fresh ginger. You could make like fresh ginger root tea really easy if you just take ginger and like boil water with it in there. That's fantastic to drink. And then fermented foods, that's a really good one. Repopulates beneficial gut bacteria. So that could be sauerkraut, kimchi, yogurt, kombucha, like all of those things can help just increase stomach acid production so your digestive health is better. And then apple cider vinegar is a really good one. So this is also like, some people do this, like wake up, have water with a little bit of lemon and a little bit of apple cider vinegar. The reason is because it promotes a healthy stomach acid production. And when people have good digestion, they feel really good. So that's why like apple cider vinegar, and it would be like a glass of water and you put 1 teaspoon in there. So it's not going to annihilate you. I legitimately took a shot of straight apple cider vinegar when I didn't realize, and right now, I'm feeling it. It rocked my world. It absolutely rocked my world. So don't ever do that. But you just put a little bit, and if it tastes horrible, then you just keep diluting it until it tastes better. But, what an easy thing to do to not have digestive issues.
My high school biology teacher claimed that he invented Claritin while working at Shearing, I think was the company. And then he would go on this whole rant about how in pharma, it's always the money's in the treatment and not the cure. And like, I don't totally agree with that, by the way. I have a lot of opinions on pharma that don't need to be stated today. But he did say, he's like, you don't need all of these drugs. You just need apple cider vinegar. He said that to me when I was like 15. And I had no idea what he was talking about because I had never dealt with acid reflux as a teenager. I could eat whatever I wanted. But, I think there's like, if there's someone who worked at a pharma company and he says that, I think there's a lot of truth to it. Yeah. So again, just trust us here that we know what we're doing. I know it's hard to go against the social norms and drugs that have been around for a long time. And we're not saying you can never take them, but there are a lot of natural alternatives, and Kat knows her stuff. She's been coaching for a very long time.
Yeah. So I would, try those. And then, that's really all you can do to have more control over the situation, and having optimal gut health is so, so important. And if your gut is feeling good, then everything else will be feeling good. So I know this is like a biggie and a really challenging one, but I've seen so many clients like come through the door who are either like fresh out of a colonoscopy appointment, like they're just doing all every test possible, and they're also on PPIs every single day for years straight. And it's really hard to work with those people sometimes because it's like, well, perhaps some of the issues you have are coming from this, and we try to work on things, but, they kind of feel very attached to taking these things, or else they know, like, what they're in for from that rebound acid secretion, which does suck, but it kind of puts people at, like, a stagnant point where, like, we can't really make progress. You don't want to go backwards, and, that's a really, really tough place to be in.
Yeah, it's hard. And it's hard because, you trust your doctor, and they are trying, but they're maybe not always looking at some of the other things that could be going on. I remember when we first worked together, in our program, we have the nutritional questionnaire, which is a lot of self-reported symptoms that help paint the bigger picture of your holistic health. And one of the questions was about PPIs. And I was like, like no one's ever asked me that before. What does that have to do with anything? And then I learned that it's actually, to your point, like gut health is kind of everything. And the microbiome is very trendy right now, I think, for that reason. And so sometimes just someone even asking you that question makes you think like, oh, okay, maybe there is more to the story than I've been thinking. And it's hard. Like, we don't have time to figure all this stuff out on our own. We're working jobs and running around as parents. Like, that's partly what we do with this podcast, is like help raise awareness of potential alternatives.
Yeah, I care a lot about the medications or things people take because it completely like impacts your internal health. Like birth control, like forget about it. Like different topic for a different day, but like these things we can't just pretend you're not taking them or like doing these things. Like they matter so much. And yeah, a lot of times they don't come up. I have to kind of dig a little bit to get this information out of people. Okay, so last one we're going to talk about is a good old nasal spray. Who has shot Flonase up their nose and felt amazing?
Yeah, it's great. It's awesome.
That shit clears everything out. It's pretty miraculous. Flonase is really wild. It's very effective, and there's Flonase, Nasonex, and Rhinocort are like the main over-the-counter nasal sprays. They are corticosteroid nasal sprays commonly used to treat nasal congestion, runny nose, sneezing, itchy or watery eyes caused by allergies or sinus issues. I think a lot of people I know who take these on a regular basis tend to be people who have like, I have allergies my whole life. I've been stuffy my whole life. Like they just have these long-term things. And I'm not saying it's because of the spray, but I think they're just like allergy type people who, and that can be really, really bothersome. I understand allergies suck. They really do suck.
They do.
Especially when they're not seasonal and just year round, you're just a little bit stuffy. But again, we go to like the root cause. Why are you having this? And allergies is one where I actually think a lot of people don't try to find a root cause because it's harder to. It's less obvious, especially if you've had allergies for a long time. But you know, some of that, like there's all sorts of reasons you could have just like more of a backup in the nose or inflammation there. So, and that's exactly how these nasal sprays work. They reduce inflammation in the nasal passages by suppressing the immune response. So, you know, these are typically used for, seasonal allergies, chronic sinusitis, nasal polyps even. So these are also, you know, for people who have every day something about their nose is bothering them. And there's a lot of negative side effects to these, like a really hefty amount. Nasal irritation, nosebleeds, thinning of nasal tissue. So your nose is just more susceptible to damage and infection. And a lot of people get sick because of what's going on in their nose or not going on in their nose. And a diminished sense of smell, temporary or permanent. You could permanently lose your sense of smell if you just use too much of this, which is like pretty wild. To think about. But these, similar to the PPIs, they have rebound congestion. I first learned about this whole concept when it came to nasal sprays, and it really like scared me because I was like, I know people who are also addicted to like Afrin. They're just like every day just doing that. I don't know. I think that's prescription. I'm not sure. But but that's it's like the same sort of thing where like you're cleared, you're like good to go. And then the next day you're like worse than ever. And that's because the nasal passages become accustomed to the anti-inflammatory effects of the spray. So when the spray is stopped, inflammation will rebound, causing more severe congestion that is worse or often worse than the original condition. And, you know, this exacerbates the cycle of dependency because the relief is so quick. And this just leads to really long-term use. I think this is one where people use for a really long time as well, in addition to the PPIs. But I think Flonase is more like, seems so harmless and just something like, oh, I have allergies, I do Flonase. You know, so that leads to just like this really, really long-term use. But yeah, completely destroying your nasal passage and causing all these issues inside your nose can like have really devastating impacts. And like this is something I think impacts people. Even like having a stuffy head is like cognitively not okay. Like you feel like you can't think and you can't, like you're just not as sharp. So, you know, I think this is such a big one.
Yep. And again, we see clients all the time who come into the program and then say what medications are on and whatnot. And Afrin, I think Afrin is over the counter actually. It's like we see the nasal spray all the time. So like you're not alone if you're in this category. Again, we're not shaming. It's like I think it's so common that we see it so often that we just wanted to address it today. So don't feel bad. Again, just you're not alone, but we have suggestions if you do want to make a change.
There are a lot of alternatives, and I actually think there are like really good alternatives when it comes to nose stuff. There are also non-addictive nose sprays. There's one called like Sinus-Soothe. It's just made of ginger, tea tree, and turmeric oil. So like all the kind of stuff I mentioned before, You do that. It's non-addictive. Also, anything that's like is a steroid will technically be like create some sort of dependence in your body. So like a non-steroid spray would be always better. But these ones, that one would be good. And also like the concept of the Flonase or these sprays causing issues is so known that there are so many good alternatives. Like it's not hard to find a good quality nasal spray. Like you will find it if you look for it. But essential oils is a really good one. Like set up a little diffuser, some peppermint, some eucalyptus. If you just like breathe that in, it really can help clear out the nose. Like I know, like obviously everyone knows of like Vicks, right? You put that under your nose, like you're breathing. So it's like kind of the same idea, but essential oils are like natural and, they also make your home smell nice, but you can kind of put that near your face. Like if you're at your desk, just have one nearby. That could definitely help. Neti pot. Andrew, how do you like a neti pot?
I was going to ask your opinion on this. I've never used it only because like I feel like it weirds me out, but I don't have a lot of research on it either, but I'm sure you're pro.
So neti pots is just like a saline wash, and for me, it's just the strangest feeling. It's like it goes up one, out the other. It's just a really weird sensation to have, but afterwards you like are cleared and it feels good. I don't love doing it, but I do know people who like really love using a neti pot. It removes irritants, dirt, and dust and mucus in your nose. So it's actually a really good way to clean out the stuff that maybe if you're like allergic to dust and that's like in your nose, you just get rid of that. It can be really, really helpful. Like I do rinses with my eyes every once in a while, not related to the nose, but I don't technically need to do that. But when I do it with like a little eye cup thing, my eyes feel wonderful. And I'm like, I need to do this more. Yeah, it's because it's like there's just crap in there that builds up. So I think it's definitely a good thing to do. And with a neti pot, you have to do it like every day for a little while for it to work. It's definitely not a one-time thing, but it's an easy approach, and some people find it like oddly satisfying. Like the feeling afterwards, it's like you do feel like cleansed. So that could be one. And then also having just a steam machine around. Steam room would be great. Just deep breathing in a steam room, that'll clear you right up. But, if you have a steam machine, or make sure also like humidity in your home is good to not dry out your nose, but like a steam machine nearby so you could just breathe in and out. That can really help. And then when it comes to allergies, like local honey is like a known thing. If you get honey from somewhere nearby, or I would say just honey in general, but if you can find local, great. That can help with an allergic response. So that kind of goes more back to the root issue. But a lot of nose stuff is also from just a weak immune system. So doing things that boost your immune system overall, also for the other medications we talked about, that's definitely like the way to focus. And that's like citrus, like things that have a lot of vitamin C. I know bell pepper has like a lot more vitamin C than an orange, which nobody knows, but that's a fun fact. Bone broth, drinking that, just eating an anti-inflammatory diet, omega-3s, turmeric, all those things just help your immune system, and then you will probably like feel better. But yeah, withdrawal from Flonase is going to be a little bit brutal, but you should, you just want to really think about the long-term use there. And I know these natural alternatives, they may seem silly, but they can be quite effective, and they're simple. And that's the thing about like simple things work, and people don't want to do the simple things. They would much rather either do something like a quick medication or something really complicated like a cleanse or like some wild diet. But like we can find like that the day-to-day simple things that are also natural that do help.
Essential oils, for example, is something that if I heard that, I would run the other direction. It's like I just think of like every girls' college dorm room, or like every hippie friend with a diffuser, and like lavender for one is incredibly proven to help with anxiety. So go look it up if you don't believe me. And then there's lots of studies now around tea tree and myrtle and like the effects that they have. And so do we have it all figured out? No. Could you take it and it does nothing? Probably. But after hearing about all the negative side effects of Flonase, are you really against seeing if one of these will help you? Like maybe it's not a bad idea. So yeah, I totally agree with you. It's like sometimes these things seem silly. And as someone who was almost about to take a pill for my restless leg, that the side effect was addictive behaviors like gambling and sex and shopping. That's a real conversation with my doctor, by the way. I started looking at alternatives and found that restless leg can actually be cured with lots of more simple things like magnesium and other things in your balanced diet. So don't throw these out. I know it can sound like we're conspiracy theorists sometimes, and we're not anti-Western medication in any way, but sometimes the answer is a lot more simple. And again, just working with a coach, working with a holistic nutritionist or something, a functional medicine doctor. I mean, they have a lot of information here to help you with this. If you feel like you're struggling, it can be hard to do alone, but it's very real.
Yeah, and hit the Google. Google has a lot of stuff that maybe you aren't. If you're just curious, it's a great place to learn. Or whatever medication you're taking, maybe just look up, what potential nutrient deficiencies it cause. That's what I look at. I'm not looking for the horrible side effects that are really rare, but I'm looking for this depletes B vitamins, so maybe I need to pay more attention to that. There's little things to pay attention to. And that's all we want you to do is just get curious and see what else is out there, but nothing drastic, and don't feel bad.
That's right.
Okay.
Is that everything?
Yeah, I think that's those three. I think, we chose those because they're the big ones. There are honorable mentions would include antacids, antihistamines, maybe even the Miralaxes of the world, the Metamucils. They're not the best quality as far as the fibers they use there. So I don't know specifically about bad side effects, but I know they're not ones I recommend to clients who can't poop.
Yep. Maybe we'll have to do a follow-up. Call in, write in, DM us, let us know if this was helpful. Don't do drugs. I'm totally kidding. There's lots and lots of places in the world for over-the-counter and prescription medications. Just, do your homework. Sometimes there are alternatives. Sometimes you don't know the side effects, and that's okay. That's all we're here to say. Well, stay hydrated, everybody. Join our strength challenge if you haven't signed up already. That launches soon. And join our community, Ultalife community. You can find the link in the show notes. And if you have more questions on any of these things, you can DM Kat on Instagram at CatBestWellness. And you can find me at Andrew Hayes Life. Talk soon, everybody.
Bye, guys.